Hey guys, and welcome back. For those who don't know, my name's Kris. I'm a GP originating from Australia, and today I'm going to be talking to you about the things that you can be doing for preventative health in 2021. So it's a new year, everyone's trying to be the best versions of themselves and set them up for success in 2021, but what kind of things should you be doing and how regularly? Those are the questions I'm going to be addressing today. Very quick disclaimer, of course, I am a GP, but I'm not your GP, so if you've got any questions about your personal health, your GP is the first port of call for that. Everything I'm about to say is general advice and the general suggestions, however, it is a very personal thing. So, without further ado, number one, eye checks. In Australia, you can have your eyes checked for free through places like OPSM, Specsavers, the Optic Superstore and whatnot. For the most part, it's recommended that adult Australians get their eyes checked every 2 years or so. This will vary, of course, if you already wear glasses or contacts, or if you have an eye condition such as astigmatism. At an eye check, the optometrist will often check the pressures of your eyes, they will look at the back of your eye into the retina to see what your general health is like, and then they will also see if you need any corrective lenses or glasses. Did you know that your eye health is actually linked very closely with your general health? There are changes that are visible in the eyes in people who suffer from cholesterol, diabetes, and blood pressure, amongst other things. So it is actually really important to have your eyes checked. The second thing you should be doing much more frequently is going to your dentist. Now again, in Australia, unfortunately, there is no Medicare rebate for dentist visits, which means that unless you have private health insurance, you will not get any money back on your visits. That being said, seeing your dentist twice a year is vitally important. Just like eye health, your teeth health or your oral health is really linked to your general health. There are studies that show that there are links between plaque accumulation in the mouth or on the teeth and heart health. So please, do your best and see your dentist at least twice a year. Again, this will vary. If you've got dental problems, you probably need to see your dentist more frequently. The third check that is recommended pretty much annually is a skin check. Skin cancer is one of the leading causes of death and disability here in Australia. We've got a very high UV index and a lot of sun, so it's no wonder that skin cancers are so prevalent. We are of course improving with the initiatives like Slip, Slop, Slap and the information that is now out there about skin cancers, but it is vitally important that you get your skin checked at least once a year. The current recommendations is that you check your own skin every 3 months or so. And if you have a partner or someone who can check areas like your back, that you do that regularly too. Check number 4 is about mammograms. So mammograms are types of x-rays of the breasts which can detect breast cancer. Currently, the guidelines suggest that this starts from the age of 50 and is every 2 years until the age of 74. However, you are able to start screening through places like Breast Screen or your local x-ray department from the ages of 40 to 49. This, of course, again will vary depending if you've got a personal or a family history of breast cancer. So please, if you have questions about when you should start your screening, talk to your GP. On the topic of women's health, number 5 is the pap smear, or now the cervical screening test. I actually do have a whole video on this if you're curious, but the current recommendation is that as of the age of 25, women or those who have vagina and a cervix should be screened every 5 years. Again, there's always an asterisk, but basically if you have an abnormal result or any significant past medical history regarding your reproductive system, you should be screened more frequently, but your doctor will be the person to ask about what is right for you. Number 6 is the dreaded poo sample. So here in Australia, from the age of 50 to 74 or 75, depends on what you read, every second year the government will send you out a little pot asking for a poo sample. This is to screen for bowel cancer. For the most part, bowel cancers are actually rather silent, and one of the first signs is blood in your poo. But the problem is, we don't always see it. So the poo test I'm talking about is the fecal occult blood test. Fecal meaning poo, and occult meaning not obvious, not visible to you. And then blood test because we're looking for blood in the poo, so that kind of makes sense. I know it seems like a bit of a hassle every second year to send a poo sample to the government. It sounds weird when you put it like that. But the whole point is that we are testing for blood in your poo. You may have blood in your poo for other reasons, like hemorrhoids, but if it comes up positive, it is an indication that you and your doctor need to have a really frank discussion about what's next, whether you need further screening, further testing, scopes, biopsies, you name it. So please, as of the age of 50, do your poo sample every 2 years. Next is ear health. So for those who are over the age of 65, it is recommended that you have a hearing test once every 12 months. Again, and I feel like I disclaim it all the time, this is screening. So if you have any concerns, that's no longer screening, that's investigation. So if you're worried about your hearing, please go sooner. Next, for those over the age of 45, every second year you and your GP should be having a really good talk about your risk of diabetes. And there are lots of factors that play into your risk of diabetes, including your family history, your personal history, your baseline sugars, your baseline liver health, all of that jazz. So, there is something called the AUS-D risk calculator, which you and your GP will go through, and essentially it gives us an idea of what your risk is of developing diabetes. And this, again, should be done every 2 years or so. In a similar vein, blood pressure. So it's recommended for those who are at low risk of having a heart disease or a heart event that their blood pressure should be measured once every 2 years. This will vary depending on your risk factors. If you are at increased risk, this may be every 6 months or every visit to your GP. Risk factors include, but are not limited to, your smoking status, your cholesterol, your blood pressure, if you've had diabetes in the past or have currently got diabetes, and that sort of thing. So again, it's very personable. It's really hard to give a blanket statement about what you should be doing for preventative health, but hey, that's what talking to your GP is about. I'm just here to give you general advice. And finally guys, I recommend that once a year you touch base with your general practitioner to talk about your mental health. Unlike many of the other things I've talked about today, your mental health can vary from day to day, season to season, and year to year. And it is recommended that you opportunistically see your GP about it, because sometimes having that little bit of help at the very beginning can prevent a lot of things from happening. Because sometimes just talking about it can help. There's no hard and fast rule about how often you should talk about your depressive symptoms or anxiety or stress. However, it is recommended that you have that open relationship with your doctor, so should anything happen, they can help you as soon as you need it. So in summary guys, it really depends on your age and your risk factors for what you should be doing. But I do recommend that once a year you touch base with your GP, because we are the experts at figuring out exactly what you need to be doing this year for your health. With all of that said guys, I hope you found this helpful, informative, or somewhat entertaining, I guess. Don't forget to like, subscribe, leave comments, all that YouTubey stuff. I'm really interested in having a chat with you in the comments if you'd like. But until next time, stay safe, stay healthy, and I'll see you later. Bye.